UTI or urinary tract infection has got a gender bias as well. As women are more prone or females are more prone for UTI than men. You won't hear a lot many men talking about urinary tract infection. As gender, women are prone because of that. People being less aware about it is because the incidence is less. Yeah. It is not that every other day we see torsion and so on. But torsion as a disease has always existed. In fact, I will even probably go to the extent of saying sometimes when they go with testicular pain and so on, even general physicians or general practitioners, non-urological doctors may not have awareness. Can I control urine? Yeah, you can control, obviously. When you don't have a chance to pass urine, you can control urine. I've seen people driving from Chennai to Trichy or Trichy to Chennai, holding back and thinking that no sensible restrooms here. Let me go home and pass urine. Now at least things are changing. We do have good washrooms all the way. The highway restaurants are good and things have changed. Holding urine is one of the commonest culprits as to why people get this urinary tract infection. Holding back and coming home is more dangerous than...
Hi, Dr. Pari. Welcome back. Doctor, from teenage girls to women, everybody is prone to UTI. So, can you talk a little bit about why some people have a frequent occurrence of UTI?
UTI or urinary tract infection has got a gender bias as well. As women are more prone or females are more prone for UTI than men. You won't hear a lot many men talking about urinary tract infection. But then these urinary tract infection in women are so common. There are people who self-medicate, who know how when it is going to hit them. They know the earliest sign it is cropping up. They manage. I'm not saying it's wrong. That's a sensible thing to do, because there are so many things which you gain with experience and so on. So they know what is right and what is wrong. So as gender, women are prone because of the anatomical structure of those orifices, urethra, vagina, and the anus, all three being in one line. And so bacteria from one orifice can easily reach the other one. So the infections are easily transmissible. Also, the female urethra, in contrast to a male urethra, is extremely short. It's about 4 centimeters in length. So any bacteria from exterior can easily swim its way past the urethra and just get into the bladder and give an infection. In contrast, a male urethra is about, say, 15 to 20 centimeters long, and the retrograde access from the exterior to the urinary tract is hard. So that is why women are prone. It is not what they eat or what they do and so on. It is the anatomical nature of the female body that makes them more prone for urinary tract infection. It does see, anatomical nature being anatomical nature. The anatomical nature of the female pelvis is the same right from birth to whatever. That is how they are more prone for urinary tract infection. So it's a gender prone disease.
So, men also do get infections,
Yeah,
but
they do get infection. In fact, when women have urinary tract infection, majority of the time there is no background reason for it. So we call it as uncomplicated UTIs. Uncomplicated UTIs are very common in women. We'll make sure that, when they come back repeatedly, that there are no factors that are contributing to it. We will ensure it. But most times, if you see, women get UTIs just like that. Just a small travel or a small phase of dehydration or a small phase of, holding back. We'll talk more about it. Can trigger off a UTI. So it's basically uncomplicated. In contrast, when men come with UTI, there is invariably a internal reason for that urinary tract infection. Obviously, they are also prone for getting UTIs due to dehydration and stuff. But most importantly, they might have an older men will have an enlarged prostate. A younger guy might have some kind of a narrowing in his urinary path, or a foreskin issue, or a poorly controlled diabetes. There is always some reason with which they get a urinary tract infection, unlike men. Men also get it, but then less common and always with a reason.
does incontinence in women contribute to UTI?
Yeah, incontinence is a whole different thing. Incontinence and UTI cannot be combined, but incontinence can be a sign of infection. There are people who come with urge incontinence, saying that the moment I try to enter the restroom, I'm not even able to go, undress and see to myself that by the time all that happens, leaking happens. So that is called urge incontinence, where there is an overwhelming power to pass the urine, and before your mind is ready and you have reached the spot, the urine starts coming out. That's urge incontinence. That's one of the signs of urinary tract infection. But so infection can cause incontinence, but incontinence causing urinary infection doesn't happen.
Like I'm 40, and off late I've been meeting a lot of women who have been talking about incontinence. So, one of the common trends is that everybody goes to the gym and they start doing these pelvic floor exercises. Is it really possible to reverse incontinence with
Pelvic floor exercises are extremely, good, particularly in, multiparous women, women who have delivered and so on. If you have not done your postnatal exercises properly as advised in the immediate postnatal period, at least now there is a lot of common sense in that. If you see, like, in our mother's time, like, there's nothing, they have not virtually heard of all this exercises and so on. So they deliver, and when they are ready to take the baby home, they took the baby home and just started raising the child thereafter. So there is no self-care in that generation. Yeah. Now we talk about self-care and how to look after yourself. Just that you deliver a baby doesn't mean that the world has come upon you. So now there are a lot of exercises and so on. See, if you are doing these exercises as part of postnatal program, then it does make a lot of sense because you don't lose the muscle. But once you lose the muscle and develop these episodes of incontinence, the stress leaks, and as we call it, a stress incontinence, pelvic floor exercise help to a certain extent. But completely reversal can happen if you're aggressively working on your pelvic floor exercises. You need to keep doing it. You need to do these pelvic floor exercises for a sustained period of time and longer as well. So that's one thing which you have to keep in mind. But a stronger pelvic floor actually gives you a better control over your bladder. So there's nothing wrong about it. Whether your stress leak is going to get okay or not, only time will answer, and it depends upon the duration you have been working out. But the urge incontinence cycle, I said about, ability to control the bladder when the urge is there, all that helps with pelvic floor exercises. But this puts us back to the first topic, where can I control urine? Yeah, you can control, obviously, when you don't have a chance to pass urine, you can control urine. But we also see women who are so terribly negatively obsessed about passing urine anywhere in a strange environment. They would want to come back home, hold urine all the way. I've seen people driving from Chennai to Trichy or Trichy to Chennai, holding back, thinking that no sensible restrooms here. Let me go home and pass urine. After getting the first sensation at Samayapuram, you understand? Like, they now at least things are changing. We do have good washrooms all the way. The highway restaurants are good and things have changed. But that used to be the case. People used to hold urine, come all the way and so on. Holding urine is one of the commonest culprits as to why people get this urinary tract infections. So I, in fact, go to an extent of saying that even if your washroom is a bit substandard, please tolerate it. Tie a hanky around your nose and you just finish it off and come. Holding back and coming home is more dangerous than passing urine in a not so friendly washroom or whatever. You can take care of your seat and so on, as you said, but then don't hold back and come home. And one another thing is that to avoid that, people also stop drinking water. Like, today I have to take a road trip from Trichy, Madurai, or wherever, Chennai, Trichy, something like that. I make sure that I get up in the morning, I do not drink water. I'll be reaching Chennai only in the afternoon. I make sure I don't drink water because I will not want to pee anywhere in between. That's again another bad acquired habit, because, dehydrating yourself also will make you prone for urinary tract infection.
So obviously during summer there will be a more people will tend to have more.
Absolutely. With all this increase in travel, people travel as families, all these road trips and so on. These all make them prone for urinary tract infection if you're not able to take care of yourself right through the travel. So for women, I still see a large number of people not too comfortable using public washrooms. So people who get these frequent urinary tract infections.
Are there any foods that can help in management or cure of UTI?
Repeated UTIs, just we ask them to address their hydration part, as we discussed. Another one is stay off sugary foods and something that's kind of sweetened. Staying off these, sweets and sugary foods does help. Obviously, hydration and using all those, this good green leafy vegetable diet, taking a lot of natural sugar. Fructose is okay. Only glucose we're talking about. Fruits and veggies definitely helps.
What would you like to share, in generally, especially with younger women, talking about UTI or parents how they can help their kids? Because
Yeah,
I hear a lot of kids going to school coming home with UTI. So
yeah. See, Adha, but the same thing that draws us to the first part, what we discussed. Somehow they get it in their young age itself as to, because at this point, I also have to say that, see, now schools are getting better. I don't know, like, you should be remembering, like, school toilets used to be really bad at once upon a time. At least in my childhood days, like, toilets used to be bad. I dread, visiting my, even if I imagine, like, how my, the toilet was in my school, I will be dread to imagine it, because it was just not well cleaned and so on. At least now schools have changed. They have this housekeeping, and somebody keeps coming inside and keeping the washroom. So one bad experience as a child, when you visit a washroom, is enough to put you off. I can tell, I can bet on that. You have always been at home, taken care by your parents, and you visit the washroom at house or wherever your parents take you and so on. They are all nice places. Suddenly you are put into school and you walk to the bathroom, you see one whole different world there, unhygienically maintained, stench and so on. As a child, that one negative impact on your brain dreads you from visiting the school toilet ever again. So there are days where you're comfortable, your bladder is comfortable. There are days where you need to relieve yourself. Then they start holding back and coming home, and only then think, school bag put, they just run inside to the washroom. That shows that they have been holding for a while. You understand? So that makes them prone for UTI. This happens very, very commonly in girl child. See, subtle signs I tell parents is one of this is that if your child is coming home and then rushing to the washroom straight away, then there is something there. Just talk to her about it, and then even you can visit the school and tell them about the toilets and so on. Why she's scared, so scared to use the school toilet? Is there something wrong there, or the way they maintain? Whatever it is, please check on it. That becomes a habit over years. You can see, like, they keep watching the television, then they cross legs. When they cross legs, you know that they're trying to control the sphincter. And then they come forward and start watching. That they're trying to compress the bladder and preventing it from giving the sensation. These are subtle signs in children you see as a parent when you raise them. And no, put your leg down, don't cross your legs, go, relieve yourself and come back. Those are instructions which you should be giving. And in change in posture, running, and then they lie down like this, then they turn completely upside down and lie on stomach. These are ways which a child develops to control this urination. It's if it happens at home, it's usually because they are doing something which is overwhelmingly absorbing on their mind, like playing a video game or watching a show or whatever. These are signs which as a supervising parent, you should pick up and educate your child. No, this will be bad. So make sure you go and relieve yourself. Don't hold back. Also, they need to be educated on personal hygiene. Those are subtle things, like, which are very, very important, and a mother can do. And for some reason, the society we were, these were kind of forbidden topics. People not used to talk about it and so on. We are growing up as a society and, telling kids how to handle themselves, how to take personal care of their genitalia and how to keep them clean and so on. So we are more forthcoming about it now.
Doctor, be it kidney stone or UTI, does stress contribute to any of these conditions?
Stress can give you bad eating habits, right? So all of us know about it. So in that way, it can contribute. Otherwise, if you see, mental stress causing a kidney stone is not something that's happened. Out of mental stress, say if you're doing some kind of a binge drinking and snacking and eating all the wrong things, doing all kinds of sinful food habits right through the day, obviously it makes you more prone for things. Travel, dehydration and all these things, which also can come out of stress, can cause UTI. They independently, they are not factors, but what you do, what the life does to you in terms of stress can make you prone for this.
Thank you, doctor. This was such an interesting talk. In general, what kind of foods really help in caring for your kidney?
See, for kidney, generally what we say is that, as we discussed in the first part when we talked about how proteins being your building block for your muscle. So you need to handle your protein sensibly. I have always seen that. That's one of the reasons. Like I told you, like, when we talk about the recommended daily allowance or what your body needs, we are trying to also tell you that don't go beyond this. So when you go we talked about whey protein, excessive use of whey protein. Somebody, a mad guy who works about say 4 hours in the gym, and prefers to have 3 whey protein shakes, all filled with big tubs in a short span of time, he's creating a overload on his kidneys by consuming excessive protein. So any protein which is excessive, mind you, again, it's excessive, yeah, you can have the recommended amount as we discussed. Excessive protein intake can tax your kidney, and instead that in turn can make your kidney suffer. Also salt, excessive use of salt in your diet can spoil the kidneys. No wholesome foods, most vegetables are safe, meat is safe, everything is safe, no food is unsafe if had in sensible amounts, including salt, protein, meat, whatever. Enjoy whatever you want, but there is a sensible way to do it, and don't overdo anything is what I would say.
I remember I met you for the first time when I brought my son in when he was about 13, 14, where he complained about a slight pain in his testes. That was a time, when he hit adolescence, and he had researched this point of why he would be getting a testicular pain and came and told me, I'm worried I have testicular torsion. Till then, I have never ever heard of this word, and I have so many friends who have adolescent boys at home. I never heard anybody ever talking about this.
Yeah.
When I read about it, I actually realized how alarming that was, and how actually adolescent boys are more prone to that, could get that.
People being less aware about it is because the incidence is less. Yeah, it is not that every other day we see torsion and so on. So it's rare entity when it comes to urological practice as well. But kudos to your son being smart enough to do a research on how his testicular pain can be torsion. One good thing about this generation, everything and anything they Google, just type in and then see testicular pain, what all can be the causes. I'm a 14-year-old boy, you'll get this torsionous thing. But this torsion as a disease has always existed. And at least now with so much of access to information, we know people talking about torsion and stuff. I used to have blank stares from patients when I say torsion. I'm talking about 10 years, 15 years back. A boy comes with testicular pain. I tell the mother, it can be a torsion. Let them send me for scan. Then what is torsion? No, testis getting twisted. No, how can testis get twisted? What is this disease? I have not heard at all. That's the first time ever they are even hearing it. But torsion as a disease has always existed. So, in fact, I will even probably go to the extent of saying that sometimes when they go with testicular pain and so on, even general physicians or general practitioners, non-urological doctors may not have awareness. Pediatricians are smart. They know they because they have come across this. Sometimes GPs don't have an idea. They'll probably. I'm not blaming anybody. I'm just basically saying that. See, only if it is in your mind, it will just come to your hand. So no idea. So just maybe you would have just hit somewhere. Thambi velada poniya, ball buttichu, or you would have turned and tossed around. Might have just self-hurt himself between his legs and so on. So all kinds of strange theories used to come, and painkillers and so on. So now the awareness is there. So torsion as an entity, still uncommon. That is why a lot of people don't know about it. But they need to know, particularly when you have an adolescent son at home, and who suddenly comes to you saying, Ma, I don't know what, it's hurting, then you need to be aware of torsion. Torsion is basically the testis getting twisted around its axis, as it hangs from the cord, as we call it. Cord is a bulk of structures which carries the semen tube and the blood supply for the testis and the vein return. All these things come in a bulk. We call this cord structure. So when the testis gets twisted around its axis, it can arrest the blood flow that comes to it. So suddenly the testis doesn't get any blood at all because of this twist.
But
we have seen
why during adolescence? Why not for a child, or why not for an adult?
Adolescence, the testis increases in size. When the testis increases in size, the twisting becomes easier. It's more prone for twisting when that size is acutely increasing. Because testis is increased, cord is still that hasn't attained the maturity. You understand what I'm saying? See, everything has to grow as a whole. Like the human body, the process. So testis increases in size, cord is slowly adapting to the increased size. In the bridge, you get the twist. If for small boy, or 5 வயசு பையனுக்கு டெஸ்டிஸும் ஸ்மாலாக தான் இருக்கும், கார்டும் ஸ்மாலாக தான் இருக்கும், நோ ப்ராப்ளம், அவ்வளோதான். இட் இஸ் லைக் வி கால் திஸ் பெல் கிளாப்பர் டிஃபார்மிட்டி. இட்ஸ் லைக் ஜஸ்ட் ஒரு பால் ஹேங்கிங் ஆன் த்ரெட்டுங்க. இஃப் த த்ரெட் இஸ் ஸ்மால் and the ball is large, the thread cannot control the movement of the ball here. You understand what I'm saying?
Yeah.
Thread thinna irukku, ball perusa irukku. The ball can just keep rolling and rotating as it wants. So, but when in a large thread, a large ball is hanging, there can be a reasonable control. And அந்த permissible movement மட்டும் இருக்கும். You can't go for a 360-degree twist எல்லாம். That kind of twist happens when you have a small string and a larger ball. So the larger ball happens in adolescence தான். Adolescence is when your body starts producing testosterone for genital growth, mustache, chest hair and whatever. So that surge in testosterone with increase in testicular size is what makes them prone for torsion at that age.
So if a child does complain of pain, what is the immediate steps a parent needs to take?
Immediate, I would say, is to see a urologist. That's it. You will have access to urologist somewhere, wherever you are, unless you're in a remote place where you don't. But at least, make sure that you reach a general surgeon. If not a urologist, at least a general surgeon in time. And if they aren't raising the suspicion of torsion, you do raise the suspicion of torsion, saying that, doctor, can this be torsion? I've seen that happening now. Like, when they come in itself, they say, doctor, he's complaining of testicular pain, can it be torsion? And I've seen like mothers are getting smarter now. Immediately get him examined by a surgeon who's dealt in dealing with this, and get something called a Doppler scan of the scrotum done. Doppler scan is basically to see the blood flow to the testis, whether the blood flow is intact or blood flow illaya, to get established on those facts, and that will give us a diagnosis right away. It's easy to diagnose and misdiagnose, both.
With respect to adolescent girls, there's always so much of awareness. The family is so focused, like, follow these kind of hygiene habits and all. For adolescent boys, is it preferable to, for example, for my son, you told me you always make sure he's wearing a V underwear, and so that will really help during the growth period to prevent this kind of are there anything else that parents can do to be help them through that process?
Like how mothers take part in teaching the girl how to keep the genitalia clean and how to self-care. Fathers have to take responsibility about teaching the boy how to push the foreskin, keep your genitalia clean. Like, that's not a forbidden place to touch. It's like cleaning your nose or ears. You need to keep your genitalia clean, push back your foreskin, wash it, keep it clean. All these are things which the boys have to be taught at appropriate age. And as always, like, we discussed about when we talked in another episode about holding back urination and all on, that the holding back urination applies to boys as well. I would say it's not only for girl child, even they need to be hydrating well, not holding back, relieve themselves appropriately. All these things have to be, so that treating your body or respecting your body in terms of certain things like hydration, genitalia, we should come out of that thing and talk about it and try to educate people around you and try to educate your children. So that's more important. Sometimes இது பூராவே all these health related or what's happening to my body were forbidden topics in a lot of families for a long time. I think now we are changing slowly, but needs some more effort.
Yeah, doctor. I mean, I'm so glad because I was so surprised when this happened, and I personally know a lot of young mothers who are having adolescent boys at home. So I think this will be very informative for them.
I'm really glad you brought this topic up, like torsion. Somehow I think whenever I talk, for some strange reason I like talking about torsion. For simple reason, like it pains the heart of urologist even to see an adolescent boy losing his testis to torsion.
You can lose your testes to torsion.
Absolutely, because as we discussed, I think this part I didn't probably mention that if the testis gets torted or twisted, 360-degree twisting with loss of blood supply, you probably have about 6 to 8 hours before you can untwist and get the blood back. Beyond that, no point in untwisting. Even if it untwists, it's going to be black. The tissue is dead and gone. You need to chop off the testis. So it's all about diagnosing on time, seeing the right kind of person to treat it, and getting it sorted ASAP. Like so many scenarios, like father is abroad, only mother is here. I said, no. You just call the father and tell him, just get this boy hospitalized right away. So that's that kind of an emergency. It's not a life-saving emergency, but a testicular-saving emergency.
Okay. So which is a very important part of life.
Obviously, then see, suddenly they get worried. And sometimes now we have testicular prosthesis, suddenly you lose one testis. It can affect the psyche of the boy also. Like, he starts feeling bad about, being how he's only with one testis and so on. There's so many things to it, other facets to it. So it's not life or death, but it's an important thing. And people also talk about fertility. Now, what if I lose one testis? Will I become infertile? Will my son father a child ever? These are questions naturally mothers will get. He is 14, 15, so that question will linger. You're saying you're taking away one testis because it's got no blood. but will he ever be able to father a child? I said, no, he'll be able to father. But see, because sperm production entirely happens from both testes. So if one is not there, other testes will do the job. But then you wouldn't want to lose an organ just because of negligence or your overreach about it. So just be a bit aware of this. Sometimes it may be false alarm. You go to the doctor, he'll examine you and do a Doppler, they'll say flow is normal, it is not torsion. So be it. But then at least
You
take
know.
the step. Yeah, you know.
Thank you, doctor. Thank you for coming in, and I really hope this conversation has helped somebody. And I hope I'll tag you in all the episodes so that people can reach out to you
Absolutely,
in case
absolutely.
they
It is
want to.
complete, pleasure talking about this wide range of common topics. And, in contrast to what interviews I have done in the past, where we used to dwell on the treatment aspect and so on. So we stayed away and we tried to give info, which can be put, like on a day-to-day use is what I'm thinking. So we covered a range of topics and I'm really happy I was here tonight.
Thanks.
Thank you.